not necessarily every day these days, but most days you and I are in touch with, in fact, you are every day, and I'm most days in touch with our hospital systems. And a shout out, he's not watching, by the way, but my fellow governor, Oklahoma Governor Kevin Stitt, just reported, came out an hour or so ago, I think, Mahan, that he has tested positive for coronavirus. He's a good guy. He's got a great family, so he is in our prayers. I think he's the first American governor to have tested positive, so keep Kevin in your prayers. Pat, we missed you. We've kept you and Linda in our prayers, and we'll continue to do so. One of the back and forths that you and I and Judy have had is that on the COVID side, too much indoor graduation or other party activities that have led to flare-ups. We talked about Westfield, Red Bank, Regional canceled their graduation. Another community canceled their participation in the last dance. I think it might have been Manasquan, but so that's on the COVID side. But you and I have also talked about we're not immune to what we're seeing around the country in terms of this lethal cocktail of being pent up, hot weather, trying to undo the stain of racism, folks trying to come to grips with community and police relations. There's a lot of non-COVID violence everywhere, and it seems like everywhere in the country, and we're not immune to that. So any thoughts you have on that front?
That's right. Thank you, Governor. Yes, it's troubling to report. I met with the ROC commander this morning with regard to shootings in New Jersey. We had 39 victims of shootings in this one past week alone, with 13 of those succumbing to their injuries and passing away. Since the year to date, we're up 19% in shooting murder victims compared to last year. So at this point, last year was 84. Sitting here today, we're at 100 shooting murder victims. And we continue. We have phenomenal relationships with our federal, state, county, and local partners. And we're certainly concerned about it, Governor, because we're seeing way too many shootings, and the likelihood of it continuing through the warm summer months gives us a tremendous amount of concern.
I mean, as we said, the cocktail could not be more challenging. You've got gobs of people out of work. You've got small businesses that have been crushed. Judy, you've got the mental health challenges gone with the physical pandemic reality. You've got hot weather. You've got George Floyd's killing and all that has gone with that. That's almost an unprecedented combination of factors.
That's right.
Other than those knucklehead indoor parties that young folks are having, anything on the compliance front of note on
There
COVID?
wasn't. I was glad to note that there wasn't any EO violations reported last night, which was good news. But again, we're focusing on both EO compliance as well as violent crime and that troubling trend that we're seeing across the entire state.
General public safety. And by the way, it's fair to say we're not unique right now. If you look across the Hudson in New York or into Philly, I mean, you see it all over the country, Chicago these days. So, folks, we're going to get through this together. Not unscathed, we know that, but we will get through this together. I've lost Dante. Dante, we're going to start over here. Mahan, we will be with folks virtually tomorrow, but we're likely, the only wrinkle to that is we're likely to have a press event and something unrelated, somewhat related, but not directly related to COVID tomorrow afternoon. We'll communicate the COVID facts with you virtually still, but I will have the opportunity to address a couple of items that are related to this in the context of that press event, which again is largely unrelated to the specific reality of COVID-19, although it is related. And then we'll be back together Friday physically here at 1 p.m. And again, we are still going to be on the Monday, Wednesday, Friday, unless there's a reason to go otherwise, in which case we will come to you and let you know. Good afternoon.
Good afternoon, Governor. I have a question about the travel advisory. This week, New York State began enforcement, asking travelers to fill out forms when they're coming into New York airports and leveraging $2,000 fines for anyone who does not comply. Will you consider enforcement for the travel advisory at any point? And is anything like that in terms of a form being done at Newark Airport?
Anything else, or is that? The answer is we're considering a number of items. Judy mentioned development of a potential technology tool. We certainly are going to be aggressively public relations heavy. We're not there on fines. We want to appeal to people's personal responsibility to do the right thing. We are happily building up our contact tracing community core, so we have a lot more capacity there than we even did, a month ago. And again, this is an advisory that New York, Connecticut, and we put out deliberately. I've said this before, that we put out before we had all of the underpinning elements of it in place deliberately. We don't normally do that. We normally get all of our T's crossed and I's dotted, and then we make an announcement. In this case, we wanted to use the bully pulpit, and we've used it every day in that respect. We are the United States of America. I say this with a heavy heart. I would love to be able to stop people and turn them around at our borders, whether that's Newark Liberty or literally at our borders. We can't. That's not the way the United States works. But we want to appeal, and we want folks to know that we mean business. And as I said, from the moment one, Judy reserves the authority to target, not as a general population matter, but if Pat flaunts this deliberately, which he won't, and comes back in from a hotspot, Judy has the power to go directly at him and sanction him. But we are not, a common theme to our principles among New Jersey, New York, and Connecticut, but executed, as we have, by the way, in a lot of other steps specific to our own constitution, our own realities within our states, and that's the way it will be. Thank you. Do you have anything? No, you're good? Hello, sir.
Good afternoon, Governor. Executive Order 163, which calls for those who cannot social distance outdoors to wear masks, how should that be enforced at the local level? One police leader told us that the Attorney General has said no to warnings and no to issuing summonses. One police leader called the lack of enforcement ridiculous and absurd and said, quote, "You can quote me on that." Since lawmakers are being asked to approve this tomorrow, can you be specific today about the ways you will spend $2.7 billion in bond proceeds before September 30th? Is the priority to undo $2 billion in fiscal year 2020 diversions, reverse programs cuts for things like the funding for property tax relief for seniors and the disabled, or is it for something else? Also, how specifically would you spend another $7.2 billion in bond proceeds in fiscal year 2021? We heard from a viewer who was just able to file for unemployment benefits after trying weekly since March, but the system is only enabling her to claim from the date she filed, not the months prior. A Department of Labor spokesperson confirms that this is the policy, and could you clarify, are residents now ineligible for their benefits during the time Department of Labor was unable to process? Finally, will the administration consider reopening in-person unemployment centers? Thank you.
We haven't, I'll start on the back. I have not, I'll speak for myself, been a part of any discussion on opening in the in-person unemployment centers. Does not mean that we won't at some point, but we have no news on that front. I hate to be a broken record, but if we could get the specifics of the information. Did you say it was a woman who just got the unemployment benefit? Can we get her specifics to Mahan afterward? It literally has come down. Now this is for months, I think probably the past 3 months. These are overwhelmingly, if not entirely, specific to the individual. And again, tomorrow is Thursday, so we'll be hearing again what the unemployment numbers are going to look like. As it relates to how we spend, it is the latitude to borrow up to 2.7 plus 7.2 for a total of 9.9. That's the latitude that we're asking for and getting. I'm happy to say from the legislature. How that will be spent is, bear with us, we're working on the budget. We've had preliminary broad stroke meetings with the leadership in the legislature. We've had our team working feverishly. I need to deliver a budget by August 25th, Matt, I believe at latest. So it's too early to tell, but you should assume that we'll be putting money, whether it's in the budget until September 30th or the budget that goes till next June 30th. I think you should assume that we'll be putting money in the priorities and the obligations that we speak about all the time. Being there for education, healthcare, keep our frontline workforce employed, meet our obligations on pension and other fronts, but the details bear with us on that. I'm not aware that of the comment about the Attorney General saying don't warn and don't summons. Here is I'll give you two ends of the spectrum on being outside. Judy, if you or Tina see this differently, jump in. You're walking down the street and you're walking your dog, or you're with your husband or wife, or you're out for a run and you're on a trail in the woods near your house, and you're socially distancing. We don't really have any interest in that. So that's at one end of the spectrum. As long as you're able to socially distance, bless you. I still think you'll see us with our face coverings on, but that's not a priority. What is a priority, and we have asked explicitly, not just the state police, but the park police and local authorities and county sheriffs, we expect folks to be warned and action to be taken if there is intense congregation where folks are not socially distancing, and it's for a meaningful amount of time. You're lined up to get a slice of pizza, you're on top of each other, and you're not wearing your face covering. That's not a good look. That's not smart. That's not a good thing for public health. So that's the sort of other end of the spectrum. I mentioned I went to one of the Last Dance games last night. I'd say mixed in terms of compliance on face coverings. But in fairness, for the most part, I can't say this completely, the bulk of the folks who weren't wearing face coverings were also not on top of each other. So more compliance, Judy, but not where it needs to be. I don't want people to think it's on an absolute scale where it needs to be. We need to see a lot more of these in New Jersey if we don't want to start looking like Florida and Arizona and Texas right now. But it is clearly better, and it's clearly more compliance when you're seeing folks on top of each other, not where it needs to be. And that has to be, it's hard to enforce, I admit that, but it has to be enforced. And we need, by the way, whether it's members of law enforcement, elected officials, faith leaders, community leaders, they need to lead by example and wear face coverings themselves, not just for their own safety, but to make a statement for the rest of us. Thank you. Do you have anything, sir? You good? Good afternoon.
Good afternoon. Thank you, Governor. Just a quick clarification first from Colonel Callahan. The 19% increase in shootings, is that all shootings or just fatal shootings?
The shootings overall are up 3% year to date, which the difference from 23 to 39, 538 to 553 year to date, but the shooting murder victims are up 19%.
All right, thank you. And I just have a couple questions on the travel advisory. Commissioner Persicelli, could you talk to us a little bit more? The governor mentioned some sort of technology tool that might be used. Can you explain that a little bit more? And would that involve tracking people with or without using their cell phones? And for both yourself and the governor, I'd like to find out how a state gets removed from the travel advisory list. How did Delaware get removed? And I believe it was last month you mentioned that Washington State was on the very first travel advisory list. Officials from Washington State reached out to you. Were they complaining? Did they give you new information? Why was Washington State removed? And is it as simple as a state can get removed from the travel advisory list if they complain to you?
May I start with that and then?
Yes, yeah, I just.
Believe me, they do complain, but that doesn't work. And no cash exchanges hands here is related to this. All kidding aside, the benchmarks are quite clear, and it's a rolling 7-day average. It's that simple. It's math. It is, Judy, help me if I get this wrong, more than 10 new cases per 100,000 residents, or more than 10% spot positivity rate. So we're reporting today 2.13. If that were above 10, and it was consistently on a rolling 7-day average. I believe Washington did highlight that the data was not accurate for them, as opposed to they went below it. They claimed that they were already below it, and I think New York, Connecticut, New Jersey were satisfied that they were right. And Delaware, not surprisingly, weren't happy to be on it. We didn't do anything about that, but their numbers came down. And frankly, the fact of the matter is, again, I hope we're not in this place again. Please God that we don't get to more than 10 per 100,000 or more than a 10% spot positivity rate. But if we did, please God we don't, frankly, I think that allows the equivalents of us in those states, or if it were our state, to say, folks, look at what happened to us. We can't let this happen. It seems to me you use that. And Delaware happily, and they had a flare-up particularly in and around Rehoboth Beach and the shore. They happily are below that, and we'll continue to watch it. Again, it's a rolling 7-day average. Anything you want to add to that, or the technology piece, Judy?
The app's just about complete. It will be on your phone and a short questionnaire, and you'll be able to transmit it directly to the county and local health departments for follow-up. The questionnaire is short. It's where you're coming from, where you've traveled, and how can we contact you. So we hope to roll that out, if not by the end of this week, beginning of next week.
This is, as you can imagine, these are not rolling off a log things. So,
If I can follow up.
Real quick.
How does a person get this app on his or her phone? Is it mandatory? Are they told about it when they arrive at an airport in the state? How does that piece of it work?
We're working with all of the airlines. So before people disembark, they'll be reminded to put it on their phone. As the governor shared, we're really focusing on personal accountability at this point in time. We'll see how it goes.
To be determined on the details. Thank you for that. Dustin, good afternoon.
Good afternoon. How quickly do you anticipate signing the bonding bill if you get it from the legislature on Thursday? What about the bill makes you think it will survive the impending legal challenge from Republicans? We've heard there's a possibility of youth sports being shut down again. Can you confirm or dispel
What
that
being
rumor?
shut?
Youth sports.
Okay.
Our hospitals in New Jersey reporting coronavirus data to the CDC that will now go to Health and Human Services, and do you have any concerns about that change planned by the Trump administration? And so far in the pandemic, you have approved a change to the open records law that effectively gives custodians license to delay requests for weeks or months. Legislature rushed through the stopgap budget bill, which you signed. The public has no say in the $10 billion bonding bill, and your office has declined to release records backing up costs for savings with the CWA and certain details about your task forces and recovery panels. Do you think the public deserves more transparency from state government, especially in a pandemic? And are you living up to your own values on transparency in government? Thanks.
On the first one, was that how quickly do we think we'll get bonding?
The legislature is expected to approve that bill tomorrow and send it to your desk. I'm just wondering how soon you may plan to sign it, assuming you will.
Yeah, I mean, I had another good conversation with the Senate President yesterday. I know they're trying to expedite this. This is something that you should assume, while I don't normally talk about these things, we've talked about this bill so much, I would say you should assume that it'll be signed pretty much as soon as it gets here. Unless Matt Plotkin disagrees, he's standing behind you, he'll agree with me. No comment on the legal challenge. I'm not a lawyer, number one, and number two, I wouldn't comment on it anyway, but I would just say two general statements. We wouldn't attach our name to something that if we thought it was not completely constitutional and legal. And secondly, this is not a comment about legality, but it's a comment on what's your plan B, folks out there? What else do you think we should be doing? I mean, it's just ridiculous, the absence of viable alternative public policy from folks who are whining about this. So I know nothing about pulling back on youth sports. Matt, you agree? Judy, you agree? fact, I was out there, I've been a spectator at, by the end of the week, 2 soccer matches and a baseball game, and I hope some more. I literally, I need you to go back, Dante, because I don't understand the hospital CDC question.
The Trump administration is changing how the data is collected at the federal level, where the hospitals, most of them send the coronavirus data to the CDC. Now that's being brought under Health and Human Services, which is basically taking it out of, career bureaucrats based in science and moving it into a political realm.
I mean, it's first, I'm not sure I was aware of that, but I would hope we'll continue to send our numbers as well to the CDC. In other words, if there's an extra burden of requests to send to the Health and Human Services, I assume, Judy, the hospital systems will comply, but they need to continue to sending their data to the CDC. I will use this opportunity that the politicization of this is bad for public health. And so when folks start to, that doesn't mean people are infallible or that every system and every process is always right. But this attacking of Tony Fauci, who has dedicated his life to things like AIDS and Ebola, and now to coronavirus and COVID-19, and folks trying to politicize wearing a mask, when we know the science tells us that keeps more people alive. I wasn't aware, Dustin, of that shift. And by the way, I'm not trying to damn HHS, because we've got very good relations there, and they've been really helpful to us. I think of Admiral Giroir is there, and Alex Azar has been there, et cetera. But if there's a sense that there's some politicization of the data or more broadly of this pandemic, I think at the end of the day, all you get, other than division, which is the last thing we need in this country, all you get is more people who are dead. And that's the very last thing we need. Dustin, I think if you were to replay a tape of your last question, you could have put that into Soviet Union 1975. It sounds like we don't show anything. I mean, we take all that stuff seriously. If I wish we had had more luxury and more time on the clock on a budget. In fact, we'd put forward an ethics package, which I would love to see put in place immediately, which is that every bill has to have at least, now was it 72 hours of public exposure? We do believe in transparency. We take every one of these requests for information seriously, one at a time. As you can imagine, we're overwhelmed with them. And so our style is to be transparent as much as we can be. But there is a reality here that the clock is very short in a lot of this stuff, that we've got a lot more demand for that sort of information than we have.
All right, folks, we are worldwide here for you on coronavirusnow.com. Take you out to our first live event here of the day. We're going out to New York City.
Restart the court system as vigorously as possible and as quickly as possible. So please, hear our plea, because that's how we will keep our communities safe. Now, back to the point about reopening schools and providing support for our children, our families, our parents. Look, we know, because we have one of the biggest surveys that's ever been conducted in the city, 400,000 people responded, parents from all over the city, every corner of this city, 75% said we want schools open and we want our kids to go to school in September. And we've talked about how we'll do it. For now, with a blended learning approach, where the typical child goes 2 or 3 days a week to school in the classroom. But so many parents have also said that they can't make it work if they don't get more childcare. We have been working since we saw the results of that survey, and we obviously knew this was an imperative. We've been trying to find every way to create new childcare and to build it from scratch, honestly, because we're having to create something that didn't exist before on this scale to accommodate a new need and a new reality. We initially said, how much could we do? And we thought maybe we could do 50,000 childcare seats. And then we realized with a blended format that actually turns into 100,000 families that can be served. We're going to use every conceivable space, community centers, libraries, cultural organizations, whatever we can find in communities. We're going to have one approach for early childhood, another approach for K to 8. And the goal will be to start by serving 100,000 kids and giving those families, those parents, that balance in their life, that relief, that support, but then we aim to go farther. Now we've got a little under 2 months until school begins. We've got a lot to do, and nothing like this has ever been attempted on this time frame. But we're going to find a way to do this and hopefully much more. Here to talk about it is the woman who has led the charge in so many ways. And I want to thank her because in her role, she doesn't get the credit she deserves, and she's a very modest human being, but she's actually been one of the most central figures in our fight against the coronavirus. As our budget director, keeping this city able to function and pay the bills and make sure services are provided to the people of the city, including food for every New Yorker who needs it and all the additional expenses around the coronavirus. She helped lead the way in expanding our testing capacity and now is helping to lead the way on the expansion of childcare. She used to be a deputy commissioner at the Administration for Children's Services, so it's something she knows well. I want to thank her for her extraordinary work and invite to speak our budget director, director of OMB, Melanie Hartzog. I don't hear you. Can we hear you? Start again, Melanie. Make sure you're unmuted. We don't hear you yet. Technology.
Okay, sir, can you hear me?
There you go.
Thank you, sir.
And folks, looks like we lost that feed here worldwide, and we'll try to get back for you.
Shout out to an ethics package, which we'd love to see get enacted. So thank you for that. Matt, how are you?
Doing well, thank you. Governor, how well stocked is the state on PPE for nursing homes and hospitals? Does the state have sufficient amount to dole out to these institutions in the event of an uptick in an outbreak? Regarding these mini outbreaks we're seeing in places you mentioned like Westfield, Manasquan, and at Red Bank Regional High School, are you rethinking allowing these outdoor graduations? And what have you learned from contact tracing related to those outbreaks? And on contact tracing, can you give us any concrete examples of success stories from tracing that has helped isolate and contain local outbreak? Privacy matters, notwithstanding.
Yep.
And just lastly, on Department of Labor, you said that it's opening up the offices isn't something that you've discussed just yet. I'm curious, given the backlog that we're still hearing about from people that haven't continued to not be able to speak to anybody in a couple of months, is it something that you'll actively discuss? And just lastly, if not, if not in-person meetings for these folks, is there anything else that can be done right now to help the backlog?
All good. Pat, I said in your absence, and Judy was my witness, I can't remember if it was Tina or Ed, it might have been on different days and perhaps both of you, that you all are working on a plan for hospital systems for long-term care to require the operators, for counties, for essential places of work to have X days, 30, 60, 90 days of capacity. But that I said that as far as I knew, the PPE is coming in and we're sending it right back out again, that we're still not where we need to be. Is that a fair assessment?
It is still the case, and I just remind everybody that very first resource request we made of FEMA, which might have been in the first week of March, they still are delivering on that, and it's probably going to be months before they could fill that. But about an hour ago, I got an email from a vendor who said they have 16 million surgical masks. We are in constant, whether it's the long-term care facilities or hospitals stockpiling on their own, combine that with the state stockpiling, we are on a daily basis seeking gloves, nitrile gloves right now is a global shortage on gloves. So it is a daily conversation, and our logistics team in OEM stays on top of that daily.
The hope is, Judy, would you agree with that assessment in terms of where we are? The hope is that we can, please God, and we're trying to, now that we've quieted down, although we're not out of the woods, the hope is that we're able to build the stockpiles back up, but we're not, I'd be lying to you if I said we were there yet, right? The mini outbreaks, Matt, I do not believe are associated with outdoor graduations. We have no data that I know of that are related to outdoor, beaches, parks. What I believe it is related are indoor house parties. And that is more anecdotal than science, but it is the indoor close congregation that's happening too much and too much among young people. And Judy's been preaching this of late, and I would just add to her pleas. Tracking success stories, I think I know of at least a couple. The wedding parties who were in Myrtle Beach, Tina?
Tina Fisher.
The Hoboken reality, not last weekend, but the weekend before.
So we are really lucky that we have a very robust local health department system and a really great healthcare provider system here in New Jersey in general, because it's usually astute clinicians, the astute local health departments that recognize well before you even get the data, in contact tracing or whatever, that there's something kind of anomalous or something unusual that's going on in their jurisdiction. So, for example, as the governor pointed out, when we had identified a possible cluster associated with an out-of-state exposure, that was something that the local health department picked up right away because they've got this experience, they know how to recognize this, and it's the same thing with our clinicians that are out there. They see that there might be some sort of association with a particular locality or a common thread, and that's what brings to the attention, what ultimately happens with the public health investigation that subsequently follows.
On your last one, I just want to say, when I said I meant that literally, I've not been a part of that discussion. That's not to say that discussion isn't going on with Commissioner Acero Angelo. So I will make sure, Mahan, we follow up on the Department of Labor question, because clearly we're trying to, as much as we can here, to reopen things, including still with the challenges. We have the Motor Vehicles Commission, where in some of those functions, we literally can't avoid being open. But let's come back to you on that, because the notion of getting as many portals to get your unemployment claims heard and satisfied is, assuming we can protect public health, Judy, we're all in for that, right? Thank you. I'm going to mask up here with my mask from Judy Persicelli. Thank you for this. I want to thank Judy and Tina, as always. Pat, to you, and great to have you back again. And Linda remains in our prayers. Jared and Matt and Mahan. Again, we'll likely have another press event unrelated on the road tomorrow. And I will speak to, likely in addition to the reason why we're gathering tomorrow, anything new on unemployment and anything new on the COVID overnight numbers, Judy. And then otherwise, we'll be back here at 1 o'clock on Friday, unless you hear otherwise. Again, folks, keep it up. Keep doing the extraordinary job you've been doing. Overwhelmingly, folks by the millions have done the right thing. Let's keep at it. Keep the rest of the country where they're on fire in our prayers, and hope that they have a speedy resolution. And in the meantime, we hope that we can keep ourselves as walled off as a state as possible. We keep ourselves walled off as much as possible, and the behavior is as compliant and good and responsible as it's been over the past number of months in the state. That combination is a winner, and that's what we need to keep after, folks. God bless you all. Thank you.
4 months since I first stood here and delivered the first of more than 80 COVID-19 briefings. An awful lot has happened over that time. In the last 4 months, the people of Illinois have once again proven themselves to be the most resilient, dedicated, and compassionate people in the United States. To put some perspective on this, Illinois now has the lowest infection rates among all of our neighboring states, between 1/2 and 1/3 of their positivity rates. Indeed, we have one of the lowest positivity rates in the country, and it's because of the individual actions of millions of our residents. Throughout this pandemic, I have always given you the facts about coronavirus and how we're doing in the battle against it. Let me begin by saying, first and foremost, this virus has not gone away. It's still infecting people, and it will likely continue doing that for months to come. But with the difficult truth comes the news that Illinois' ability to manage COVID-19 looks a whole lot better than it did at the beginning. Unlike in late February, we now have significantly greater capacity to test for the virus and to trace the contacts of those who test positive so we can limit the spread of the infection. Ours was the first state in the nation to be able to test for COVID-19. Now Illinois is hitting a record weekly average of more than 33,000 tests per day, crossing the 2 million test threshold earlier this week. Today we report testing of 38,161 people. Our state testing is among the best in the nation, and we have tripled the number of contact tracers that we had just 6 weeks ago. In the first 2 months, our 7-day rolling average positivity reached over 23% at its peak. Today, we're averaging 3%. Illinoisans worked hard to get our numbers down so that we could build back some aspects of everyday life in relative safety, moving through the phases of Restore Illinois over the last few months. For over 2 weeks, all of Illinois has been in phase 4 of that plan. And while there can be adjustments to allow greater flexibility for businesses and individuals, we cannot reach phase 5 until we have a vaccine, a very effective treatment, or the elimination of new cases over a sustained period of time. That said, many people want to know if we're out of the woods, and they're wondering what's next. So I'm here today to outline the path ahead and make sure that we all know what will cause us to impose further mitigations. First, opening up our economy does not have to come with a spike in cases. Other countries have done it successfully while reducing cases and infection rates. But that requires vigilance on the part of all of us. It's imperative that individuals, families, workers, and businesses follow the recommendations of doctors and epidemiologists, that we act quickly if we see any outbreaks and upticks, signs that could lead to a surge of coronavirus infections. Our guiding principle remains the same as it has been from the very beginning: keeping people safe and healthy. The virus is unforgiving, as we have seen in states in the South and the West. So it's important when we see trends in our data that indicate a potential problem in any region of Illinois, that we need to start tightening mitigations in that region before it's too late. The epidemiologists and professionals at IDPH have determined that we need to take action in a region if we see a sustained rise in the positivity rate, along with either a sustained increase in COVID-19 hospital admissions or a reduction in hospital surge capacities. A sustained rise in the positivity rate is defined as an increase in the 7-day rolling average for 7 days out of a 10-day period. In addition, if any region hits 3 consecutive days of an 8% average positivity rate, that will require action, period. These metrics are clear. Staying under these metrics will allow us to continue in phase 4 without having to take significant mitigation steps. At the end of the day, job one is to keep you and all the people that you love safe. We're also today changing the boundaries and the number of health regions in Illinois. Unlike when we first introduced the Restore Illinois plan at the beginning of May, our growth in testing and tracing has given us a much more surgical ability to manage outbreaks and address problems locally. So going forward, we have the ability now to monitor and measure progress in 11 separate regions, based largely on our 11 hospital emergency medical services regions, referred to as EMS regions, that have traditionally guided IDPH in its statewide public health work. For ease of management of this coronavirus pandemic, we've redrawn some EMS regions, but left most of the regions as they were. For example, the city of Chicago will be in a region of its own, as will suburban Cook County. As for the collar counties, we've shifted regions based on geographic contiguity. For example, Kendall and Grundy counties will now be in a region that is not part of the collar counties. Remember that the goal of the regional lines is in large part to make sure that there is healthcare availability. This plan lays out an array of mitigation strategies that can be applied if a region breaches the resurgence metrics. These mitigations cover categories like bars and restaurants, meetings, social events, religious gatherings, and organized group recreational activities like adult and youth sports. In each category, we have 3 tiers of mitigations, allowing us to move carefully but deliberately, depending upon the severity of the situation, to control the spread of the virus while continuing to allow a region to be open to the greatest extent possible. These mitigation options allow us to move decisively without reacting more broadly than circumstances require. We're focusing on detecting and mitigating localized outbreaks by working with municipalities and counties to take targeted steps to contain outbreaks. With our new mobile testing units, greater testing capability, and increased contact tracing, local public health departments working with IDPH have been able to limit community spread in a number of those circumstances. Unfortunately, outbreaks are taking place consistently and in every region of the state. In just the last few weeks, we've had outbreaks tied to athletic camps, July 4th parties, and churches. As I said yesterday, bars remain another concerning source of rising positivity rates in various regions. As we've seen concerning trends, it's been important to me to sound the alarm with local officials who can take immediate targeted steps before we intervene at the state level. For example, I reached out to the mayor of the city of Chicago last week because of the concerning uptick in their positivity rate. I'm also deeply troubled by outbreaks that we're seeing all around the state tied to activities like youth sports, like in Lake Zurich, where dozens of students and parents have tested positive in a related outbreak, and in Knox County, where a teen softball league is also experiencing an outbreak. Remember, the degree to which we can reduce risk and restore aspects of our daily lives is still unfolding. We're continually evaluating what works and what doesn't work. And we're taking a good hard look at how youth sports fits into that conversation. Let me reiterate what I've said from day one. IDPH and I are ready to take immediate action there and elsewhere if trends in the data require it. Looking ahead, I know that many people have concerns about in-person learning in schools. As a parent, I share those worries. Every school district is different. Different building sizes, different flows of students across campuses, different numbers of students and teachers per square foot. One size doesn't fit all. So the Illinois State Board of Education recently released guidelines for how districts can return to in-person learning. There's room for adaptation to local circumstances in the guidance, but there are some requirements that must be adhered to. For example, face coverings, distancing, and classroom capacity requirements. In every decision relating to this viral threat, schools must focus on giving our children the best education possible while offering the greatest consideration to their health and the health of their families and all of those who work in our schools. And as indicated by the ISB instruction, hybrid schedules and remote learning are likely to be a part of that solution. Parents should be fully engaged in understanding what policies each district is moving toward and should be fully included in discussions of how to adapt to local and individual needs. But to be very clear here, any district that intends to disregard this guidance is gambling with the lives of our children, teachers, and families. Districts that don't live up to public health guidelines and standards and don't make a genuine attempt to protect their communities from this virus could be held liable in the courts by community members who are ill-affected. I'm a father. I understand that parents are worried sick about having to choose between seeing their kids miss even more in-person schooling at critical ages and the very real threat of this virus. Good people with good intentions can disagree on how and when kids should go back to school. But let me be clear, I wouldn't let my own children return to a school where masks are not mandatory, and serious effort hasn't been made to keep students distanced during the day. This should not be controversial. Remember, the degree to which communities can mitigate risk and restore more normalcy to daily life in the months ahead is, to a large extent, in the hands of the people of our state. Taking precautions, following the mitigations recommended by doctors and epidemiological experts, like wearing masks in public places and keeping some physical distance, are necessary for us to keep all Illinoisans safe and healthy. Throughout this pandemic, it's been my priority, shared by Dr. Ezike, IDPH, and the rest of my administration, to ensure that Illinois would not be too proud to evolve our path forward if new information encouraged us to do so. 2 months ago, when I introduced the Restore Illinois plan, I said, we can and will make this smarter as we move forward. And we're doing that today, as we have all along the way. Scientists and doctors and researchers learn new things about this novel virus every day. That fact should humble us. There's a difference between learning by questioning and sneering in the face of facts. And in this moment, as we face down a global pandemic, as our communities struggle with massive economic upheaval it has brought on, and as we renew our call for racial justice, when it comes to the unknown and the uncertain, now is a time to err on the side of compassion for our neighbors and empathy for the most vulnerable among us. On that note, I want to end with a renewed call to action. The research and science are much clearer about COVID-19. There are things that we do know and we know work. 216 studies of mask wearing and distancing have been evaluated, and they collectively confirm that masks and distancing bring down transmission rates and the risk of infection. That is a fact. The single best thing that you can do to help our state, to help your neighbors, to help your community, is to wear a mask in public. So follow Dr. Ezike's 3 W's. Wear a mask, watch your distance, wash your hands. You can also help in another way. If one of the 1,450 contact tracers calls you, please answer. Also, in Illinois, everyone, regardless of citizenship status, who needs to be tested should go get one. Our state-run, community-based mobile and drive-through sites are free of charge to anyone who shows up. Private insurance and Medicaid-covered families can get tested at other locations at no cost as well. On top of that, anyone listening who has a device and an internet connection can help too. We provide county-by-county data on the IDPH website that will allow you to monitor how your local community is doing at reducing coronavirus spread. That allows you to spur action by your local elected officials to provide additional mitigations to reduce your local infection rate and keep you and your neighbors safe. Everyday Illinoisans with an interest in ensuring your neighborhood is seen safely through this pandemic can use this tool to hold your local officials accountable. Illinois, this journey has not been easy. Coronavirus has ravaged families, made many people sick, and has killed more than 7,000 of our fellow Illinois residents. Not a day has gone by where I haven't wished for a magic wand to rid our people of the pain, the loss, the trauma of the last few months. But the virus is still here. Ignoring it, trying to wish it away, is not going to help us beat it. A quixotic rush to regain a shadow of our former lives today will just delay a real return to normal later on. When you go out without a mask on, host secret parties, stuff your bar or restaurant to capacity despite the warnings, ignore common sense in your worship practices, it's not a political statement. You're hurting your neighbor who is desperate to keep their business open, or your friend who has an immunocompromised child who has been inside for months, or your parents who don't have the same defenses against this virus that you may. This isn't about politics or campaigns. It's about the people that we love and care about in our own communities. Here's what I know for sure. We've seen some success, however relative, while other states are seeing surges. Because the people of this state show up for each other, show up for science, show up for our doctors and nurses on the front lines, and show up for your community time and time again. That should give us all great pride in Illinois. We need to keep showing up for one another now more than ever. So thank you, and I'd like to now turn it over to our IDPH director, Dr. Ngozi Ezike. Doctor?
Thank you, Governor Pritzker, and good afternoon. First, let me just start off by saying that there is no more ardent supporter of the success that we have enjoyed in Illinois with respect to this coronavirus than our leader-in-chief, Governor Pritzker, so thank you for your tireless efforts. And second, a point of clarifications regarding the 3 Ws. There's not mine, it's ours. I saw it out there, and I think there's importance in widespread messaging that we all use the same terms. And so I saw that and said, yes, that's a great thing, and I want not just our state, I want the country to hold on to the washing our hands and wearing the face coverings and watching our distance. So if I were to make my own, I think I could inartfully come up with something. C's, the 3 C's, cover your face, clean your hands, and the last one's a little bit harder, count your 6 feet of distance. But the fact is we are still in this pandemic. No one asked for a global pandemic to rock our world, to steal our loved ones, to totally upend what's normal. No one asked for our daily routines to be disrupted. Nobody asked for our summer, as what we used to know as summer, to essentially be canceled or significantly changed. But the invisible enemy persists without a vaccine and without an effective cure. So yes, we stayed home initially and we made it very hard for the virus to find people to infect. And that was so key, and that's why we're sitting on the success that we have. That's why we have the lowest positivity rates for any states in our region. Less people infected meant less people hospitalized. We went from having 800 individuals lose their lives in 1 week to having under 200. And of course, 200, under 200, 150 is still too much. But please appreciate that significant decline. Our positivity rates have come down. Our hospital admissions for COVID are lower than what they were months ago. And no matter where you go online, again, other people are sharing different facts. Illinois is always on that small list of states that's trying to get it right and maintain that. So that's great. But here's the kicker. As we opened up and graduated into phase 4, that meant that more people were out and about. And what does that mean? That means there is the greater chance of getting infected. Remember, we still don't have a vaccine or a cure. But the deal was that as we go out and try to get back to some level of normalcy, that we would have the mitigation strategies in place. And those were the 3 W's: the face covering, washing our hands, the watching our distance. So I thank all those who have been adherent to those 3 W's, but we need more uptake of this, and we need more participation in this key measure that is supposed to help us fiercely guard the successes that we have seen in Illinois. As the governor stated, there are multiple, dozens and dozens of reports just this week of outbreaks from a myriad of different activities, from house parties to sports, to churches, to travel, to hotspots outside of the state. But I also want to highlight the who of many of these new cases that we're seeing. Please be aware that young people, again, breaking off the age ranges in deciles, ages 10 to 19 and ages 20 to 29, they are having higher case rates now than ever before in this pandemic. We are following this very closely, but young people and parents of young people, please be aware. This virus is now being spread by youth, by younger people. So young people, we need you to make responsible decisions to help us continue to keep our successes and decrease and minimize spread. And of course, parents, as additional support and leaders for these young adults, I pray that you will assist and guide these teenagers and young adults to make the right decisions, as everyone's decisions affects all of us. So looking at the numbers for the day, since yesterday, 1,187 new confirmed cases were reported to IDPH, which brings our state total to 156,693. Unfortunately, 8 deaths were reported to IDPH, which totals 7,226 deaths lost to COVID since the beginning of this pandemic. Again, as of last night, 1,454 individuals were reported to be hospitalized with COVID, and of those, 324 patients were in the ICU and 130 patients on ventilators. Our goal of increased access to testing is continuing. In the past 24 hours, 38,161 tests were resulted. And earlier...
All right, folks, you requested it. You are getting it. Let's go out to LA right now. Police chase happening right now in Southern California with this white pickup truck. You could see just moments ago they tried to do the stop sticks, and it looked like it. Boy, it looks like it's going to work here. See that back tire? Looks like it's already going to be flat here in about a minute. Let's hang on here. We are worldwide, as always, for you on News Now. As always, this is the voice of Police Chases, Mike Page, with you here today as we are bringing you this live chase, uninterrupted. I'm with you here through the whole conclusion. Don't you worry about it. Pickup truck that we are seeing the stop sticks just moments ago We caught that, and it looks like at any moment this car will not be drivable, this pickup truck here. You can see the back tire. It's running flat right now, but just how long will it go? We don't know, but we are always here for you. The voice of police chases here with you worldwide. As you can see, just trying to, the suspect is looking like he's just trying to make it a normal Thursday morning drive, when obviously it's not normal at all. Sir, you have a flat tire because they just put the stop sticks on you, and he's going to continue to try. Look at this. Look, buddy, you're not going to go anywhere. Just give up, please. I need some water up here right now. Yeah, we'll take some water. All right, sir, just get out of the car and get to the ground. I mean, what's this guy thinking? He has a flat tire. Let's go. Let's go. This might be the worst police chase I've ever had. Thanks for that water. Appreciate it. All right, I'm done with this. All right. Thank you, everyone here. Police chase wrapping up in LA. Let's go back out to more coronavirus news. Wow.
Tested. And maybe more of you are getting tested because you have identified exposure risks. Important reminders as we are out and trying to live our lives. We cannot control this situation without masking and distancing. We cannot. Number two, if you learn that a friend or a relation or a contact of yours tested positive, you have to undergo a 14-day timeout. You need to wait at least 6 to 7 days after your exposure to get tested, because that's a better chance of actually showing a positive test result. If you find out a day after you got contacted by your friend that the day before they were positive and you were with them just that day before, it's too soon to get a test. So please, a 6 or 7 day window after your exposure is the ideal time to get tested. But even if that test is negative, a negative test does not buy you out of the 14-day timeout. I know that's hard to take. You're feeling fine. You got an initial test. It says you're negative, but that test is not enough to take you out of the 14-day timeout. We have many individuals that have not been positive on day 6 or 7. Up to 30% of people might still test positive or develop symptoms on day 8, 9, 10, up to day 14. So in the interest of not spreading it to other people, we have to do that 14-day quarantine. Also, if you have a positive test and you don't have symptoms, you still have to isolate for 10 days. Not having symptoms does not mean that you're not infectious and does not mean that the test was wrong. And to help the general process, please, we have to be vigilant. Keep track of where you have been and who you have been around. In the event that you do test positive, that you can help identify as the contact tracers reach out to you, as you even take your own personal responsibility to reach out to those who may have been exposed. Make sure you notify your employer, your social networks, your family networks, your religious groups, your sports groups. Please be a responsible citizen and share to people who may have been exposed in case you get to them before the contact tracers do. Cases are increasing across the country, and even in some areas in Illinois. With our local health departments, we are aggressively identifying outbreaks in Illinois to control them before they spiral out of control. I continue to salute my team at IDPH as well as all of our local health departments for their work since the beginning, but it's not over. So outbreaks are identified in these calls, and we need your help in giving them complete information. Contact the health department to report that a group of individuals have tested positive or have symptoms that are concerning. And then IDPH also looks through our many data sets to identify different clusters. We want to identify as much as possible. We need to know where it happened, who was involved, how many people, where were the likely exposures. It can be, as mentioned, within sports settings, bars, restaurants, factories, we see cares, any place is possible. Local health department consultation with IDPH will recommend control and outbreak response measures, which include quarantining of the close contacts. That's the 14 days from the exposure to wait and see if symptoms will occur. Testing plans are shared and improvements are needed to prevent transmission with infection control procedures in place. A few weeks ago, we announced the arrival of Phase 4, which was a testament to how well we as a state responded to this pandemic. We did it together, and we are still needing to work together to get through this. The 3 W's will lower the spread of the virus. That's incontrovertible. The important actions and sacrifices today will directly affect what school looks like in the fall. So we all have a hand to play in what our future looks like. Please bear any inconvenience that you think is associated with wearing a face covering. Bear that inconvenience to prevent much larger inconveniences down the road. I implore your support. I implore you to follow the 3 W's. I implore you to take care of your fellow resident here in Illinois.
8%, I believe is what it was, right? Over 3 days.
If we spike to it, that's what that's meant to be. It's a fail-safe.
What is immediate action? What are the consequences?
Well, again, there's a menu of things, and I talked about some of them in my remarks. For example, and I mentioned yesterday, bars as an example of something that would certainly be, it's a thing we look at. We've seen studies of the spread transmission that can take place if bars are overcrowded. And often there's been a capacity limit of 25% put on bars. They are not following the rules in many cases, and there's transmission. That's one example. Another example is youth sports. We've seen this summer just some examples I talked about. Those are among the menu of items you heard me talk about. But let's not focus on the 8% fail-safe number. This could happen much before that. In other words, the menu of items that are mitigations are about the numbers moving the wrong direction in a sustained period of time. That doesn't mean it got all the way to 8%. It could be that a region is moving very quickly upward, but doesn't reach 8%. But over a sustained 7 days of 10, the 7-day average positivity is moving up. That is a trigger, along with the availability of hospital beds or the increase in hospitalizations. So those are, I know it's complex, but we wanted to lay out for you and be very transparent about what the trigger, what we're looking at. I've said to you all every day, I wake up and look at these numbers on a daily basis. I look at the rolling averages of these numbers, and so does Dr. Ezike. We're constantly evaluating and making decisions about what is it that we may need to do. Before we ever get to those points, as you heard, I call local officials, or Dr. Ezike speaks to the local health department to say, there is a problem in your county. What are we doing? How can we be of help to you? What are you doing about it? Governments have the ability more immediately to do things than state governments, and so we encourage that. But where state government needs to step in, we do and we will.
To what degree the reversal in numbers of studies is a matter of people just becoming patient, or is it simply Illinois being an island in the middle of these spiking numbers? neighboring states?
It's an excellent question. You are right on. We ask that question of ourselves too, because when you look at areas like St. Clair County and Madison County, right across the river from St. Louis, Missouri has I forget the exact number from Missouri, but I think it's around a 7% positivity rate. Ours is 3%. So if you live in that area and traveling across the bridge to Missouri, you're essentially doubling the possibility that you will, could contract this, or at least the number that you end up in front of. It's very important for people who live in those areas to be aware of following mitigations that we've suggested in Illinois. In other words, maintain your distance, wear your face covering, even if it isn't required in the state that you're going into. That you want to protect yourself, certainly. You hope that people there will be protecting you. But so we worry about the border areas and people who come over the borders. People live in Illinois and work in a state that's bordering Illinois, and they every day go back and forth. And that doesn't mean that they're in any greater danger as long as they're maintaining distance, wearing a face covering, washing their hands, following the mitigations. So that's one thing. To what is this about complacency and people just deciding that, I'm done with this? Look, we worry about that, of course, and I think you see that there are young people. I don't know whether they were following MIDI earlier, but you often see young people going to bars or just, gathering in large groups, having parties with one another, not thinking that either that they're vulnerable or that they could be carrying it to someone who is vulnerable. So we worry greatly about that. That's why we have a lot of social media. That's why we've done outreach to organizations all across the state to make sure that people are paying attention. And then I can't help to mention that there are people who view this as political, that wearing a mask is, and keeping your neighbors safe is political. It's not political. This is just about caring about your community and about people you love.
To follow up on the young people, and this might be better for Dr. Ezike.
Sure.
The statistics of the cities today show that by far the largest group of new cases were from the 18 to 29-year-olds, 30%. Can you tell us on a statewide basis, are you seeing similar things, and how does that age group compare with previous?
Right. So I will say that we've made tremendous progress. Our long-term care residents, which are obviously a much older population, and so that used to be a very significant driver. But in the recent weeks, we have seen the 20 to 29, and again, we have so much data, and when you break it out, it might be the case for, I think, non-Hispanic whites, 20 to 29, that's the largest group. Then you also had that in blacks, 20 to 29. But then you've never seen this high rate for the 10 to 19. That is new in terms of the numbers climbing over time now at the highest rate that they've ever had from the beginning of this pandemic. So
what is that rate?
I can't remember all these numbers off the top of my head, I'm sorry, but I can make sure that they get that to you. But as we follow over time and as we follow the total people who are being infected, who are now infected, we are just seeing that there's a new shift in where the burden is lying, and that's why I'm trying to elevate that. And we have a youth forum that we're working to try to solicit young people, because we need to understand what they need to have to make the best decisions. Is it that they don't understand that they can infect and go on to infect others? Do they really think that they can't get sick? Because we do have many examples of young people without comorbid conditions. They understand that if they are infected and have a history of smoking or vaping, that could portend a much more serious. So we want to make sure that the young people actually have the information. Maybe it got mixed when we talked about elderly people in the nursing homes and they thought maybe they were somehow immune. So we want to correct the narrative if it was misunderstood and make sure we get them the right information.
I don't mean to hog here, but just 10 to 19, even though a lot of focus has been on bars, that would suggest an age group that, of course, can't be in bars. So where is the source of this?
So that group, I have teenagers, right? They've been on lockdown, but they are complaining that their friends are out and about, and kids are congregating.
More social action.
Yeah, social action, social gatherings, home get-togethers, trips that are not sports, that are not involving, and distancing.
So how does that pretend for schools?
Well, we know that if schools are to happen, there has to be masking and distancing. But to get there, we have to not have widespread community transmission at rates that are not sustainable to even safely do school. So that's why our actions today, right now, will determine what school even looks like. And so we need to, the gains that we have achieved, we can't rest on them, but we need to aggressively and fiercely protect it. And that will involve universal masking and distancing. Thank you.
Can we talk about the new health regions? Because
sure.
I think that's important today.
Sure.
Hopefully folks are going to be in the Collier County say, great, we're no longer part of Chicago, or we're no longer part of Cook County. But I'm just wondering down the road, if you do have to go backwards, are you also then saying folks from Chicago might travel to these other counties because you can't dine out in the city? Should that happen?
Well, let's take you worldwide here on coronavirusnow.com. Take you out to Speaker of the House Nancy Pelosi's weekly news conference.
President to activate the Defense Production Acts so that we can get the equipment we need. The president made so many bad executive decisions. We wish he would make a good executive decision and do that. Observing his behavior, I have concluded that he is like the man who refuses to ask for directions. All of the answers are there. The scientists have the answers. We know that testing, tracing, treating, distancing, masking, sanitation can stop the spread of this virus. And yet the president continues to go down the wrong path and refuses to ask for directions from scientists who know better than any of us. So again, we observed that it was 2 months. In that period of time, 2 million more people, 2 million more Americans have become infected, for a total of 3.5 million people infected. Since that time, 50,000 more people have died, for a total of over 137,000. Tens of millions of people are still out of work, and UI benefits expire soon. And today we marked the 17th straight weeks of more than 1 million people filing for UI benefits. And we still don't have the needed testing and PPE. And the president refuses to use the full power of the Defense Production Act needed for reopening our schools, reopening our economy, and the rest. So many people have said, I've had a test, but it's taken me at least a week, or sometimes 2 weeks, in order to get the results. You know why? Because there's not enough equipment. So many people have said, I couldn't get a test because I was not qualifying with a disposition or precondition, whatever it is, an impending operation. You know why? Because there isn't enough equipment. So why, for what reason does the president not fully implement the defense bill? And in hospitals and in places giving care to people, there is not enough PPE, personal protective equipment. There is not enough equipment. But we could have it. President executed the Defense Production Act. We called for it in the CARES Act yesterday. A number of our, not yesterday, the 14th, a number of our colleagues wrote to the Secretary of Defense and the Secretary of Health and Human Services and asked why was this, the DPA, the Defense, not used in the way that was called for in the legislation. An assessment of the amount of each of the categories that we need: PPE, diagnostic, serologic, the COVID test, treatment for COVID-19, other medical supplies and equipment, the list goes on. This is such a massive dereliction of duty. People are dying. And so what we are saying to the Senate, join us and the President to use executive action for good instead of ill, as he has done, and pass the HEROES Act, which, as you know, supports our, but let's just focus on what it would mean for our schools. Because across the country, the angst that people are reporting to us about the anxiety they have about their children, the decision as to whether to send their children to school. What does the president do? The negative. We're not going to give you money unless you open up. No, you give schools money to open up. And that is precisely what we do in the HEROES Act. We have $100 billion education stabilization fund specifically geared to the coronavirus. Quite frankly, with the time that has gone by and the attitude that the president has had, the negative attitude the president has had, we probably will need more money. We do have in the moving forward legislation that we passed, our infrastructure bill, we have another $100 billion for school construction. What was important even before coronavirus is about ventilation, it's about wiring, it's about getting rid of lead poisoning in the school. It's about meeting all the needs of our students. We tell our children that education is important, that they must study for their own personal, to reach their own aspirations and for the good of our country. But we send them a different message, send them to schools that are not wired with the technology for them to learn properly and modernly. When there's lead poisoning that makes them sick and diminishes their capacity to learn. When the ventilation systems are such that it exacerbates the situation. And now, all of that exacerbated by the coronavirus. So if we add that, and then, of course, we have the resources to honor our heroes by supporting our state and local government. And much of what state and local government does is the education of our children. But they've had opportunity loss, their revenue loss because of the coronavirus, their revenue loss, their outlays of cost because of having to pay for coronavirus care, et cetera, has given them serious budget deficits. So let us honor our heroes by doing that. Let us open our schools and open our economy by testing, tracing, treating, isolation. These schools are saying they should be 6 feet apart, that's for sure. You're going to need fewer people in the classroom, so you need more space, therefore more teachers. And the president is saying, if you don't open up, we're going to deprive you of the 8-point-something% that the federal government provides to state to schools in our country. State and local will do over 90% of it, and they have, again, serious budget deficits because of the coronavirus. Again, we need the DPA to open up schools, to open up the economy, and we need to help America's families. Actually, if you put it all together in our two packages, we have $230 billion specifically for the schools, and then we have nearly $1 trillion for state and local government, which I remind you is 1/2 what they gave away in their tax break, 83% of the benefits going to the top 1%. So in any case, Mr. President, admit it, you've gone down the wrong path. Ask for direction. Ask for direction from our scientists who know better. They knew better. As we urge the President and the GOP Senate to get on it and help the American people, help our state and local governments by honoring our heroes, open up our economy and our schools by having the equipment needed to do it and the funds to facilitate that, put money in the pockets of the American people. The time is running out on that. This is drastic. I know we keep saying this over and over, but it still persists, and the clock is running out on it. But as we urge them to do that, House Democrats are still working very hard for the people. This week, Appropriations Committee has been marking up the fiscal year 2021 legislation, putting it on track to have passed legislation to fund 96% of the government in July. For the second time in 2 years, we have been on schedule. We will pass those bills next week. They're being marked up this week and last week. We're holding nearly 30 hearings and markups, as we are here now, across committee. Energy and Commerce markup yesterday, at this time, some of it yesterday, 30 health-related bills and hearings on COVID relief and vaccine pandemic preparedness, environmental justice in the era of COVID, and much more. So we have a line on. We will be taking these votes to the floor next week to be on schedule to meet the needs of the American people. And again, the clock is ticking. The unemployment insurance will run out by the end of the month, even before the end of the month. We need to have the direct payments to people. But on the subject of the kids, you know, I'm a grandmother, a mom, 5 kids, 9 grandchildren, all ages. The youngest one is public school in San Francisco. We're very concerned, not only for her, but for her classmates. They don't all have all of the technology that would be needed for distance learning. All of them, many of them go to school for meals. Now they go to school to learn, but they food there. And so with all the concern that we have for all children, we have to make sure all of that is in place. But that's a situation that's replicated across the country. And so instead of threatening schools, instead of the Secretary of Education saying children should take risks, astronauts take risks. Oh, really? Oh, really? So in any event, this is personal. It's about our children. And at the very least, the president could say we're going to have the equipment necessary. Any questions? Ma'am.
Madam Speaker, you're talking about spending billions, if not trillions more
Yes.
money on this bill. You and Mitch McConnell still have not agreed on a chair for the oversight of this money. What's the holdup?
We had different suggestions about it, and we came to a conclusion about an excellent person, and he agreed. There's some process in the Senate, which I was not aware of, that takes sort of time, and that was a deterrent for the person staying on board that long.
Mr. General Dunford?
Yes. Yes.
So who's your second choice?
Well, I've proposed someone to the leader, and we'll see if he accepts. But I won't be announcing it right here. But this is, you know, it's a funny thing. You would think it should be the easiest thing in the world to such a conclusion. And I was particularly proud General Dunford was interested in considering this, because I think that a person of his stature and in the military, person who knows how to manage things, a leader, completely apolitical, would have been the perfect person. I just don't know, how the word got out about him. For there was an announcement which then what are we waiting for? Part of the issue. So I would hope that we would have somebody. There are plenty of people in the military who would be willing to exercise their patriotic duty in an apolitical way with their management skills and the rest, and that's what I'm hoping will happen. Yes, sir.
Do you have any contact with anyone in the administration over this next package, coronavirus package?
Everything in this package, except for like 75% of what is in this package, is what we have had in previous bills. So nobody is being asked to vote for something they haven't voted for before. The one thing that is different is they have resisted in the past any strong OSHA standard. And that is absolutely essential for us to have to protect our workers at all times, but an intense, even stronger one at the time of coronavirus. So they know what they have to do. There is another piece that they have resisted that is very urgent now. They resisted